Yeah, that kind of leads me to another question, like, because Philip was kind of telling me something about it. Like, when you walk into the room and you're like the head brain surgeon in the room, what's the best way I can ask this? Do you think they're surprised because you're a woman, you're like a attractive, respectfully blonde woman? Do you sense like them being like
Um,
not taking you serious because you're
oh,
not like you
I'm
know
not a
what I'm
distinguished man with a little bit of white hair. Distinguished six
exactly
foot tall white man with a little bit of a gray coming in the beard.
exactly.
Yes. Yes, but I actually have found it sometimes it's frustrating because, if I'm at home and I'm trying to just live my life and I get called at 2 in the morning to do something and patients are like, "Hold up. How old are you? How many of these have you done? You're a woman. I'm not used to this. I'm old fashioned." Then
Mm.
sometimes I'm like, "Guys, there's no other option. Sorry." But
How can you insult the person that is about to
but no, I try to put my
yeah.
I try to put myself in their shoes if I was a different mindset.
Okay.
But honestly, you know what is nice about it is there about I would say about maybe 2 out of 3 times
Mhm.
they I get a look of like what's
Is
happening,
this a
especially in an
DEI hire right
yes,
here?
yes, especially in like an emergency where it's not like they have a visits plan and they can look somebody up and see in an emergency it's just it's all nobody has time for that, so you're basing it on your preconceived notions about people.
Exactly.
So sometimes they will first look at some people will blatantly ask me, how old are you, how many of these have you done? I'm sorry, but I don't like I don't know if this sounds bad or this is discriminatory, but I just don't. It's it's a very sort of concern, right?
Mhm.
But one of the nicest things is when you have to earn people's trust and respect,
Right.
because sometimes you can be anybody and just show up in a white coat, and just because you look a certain way and talk a certain way, people will just give you that respect and trust, and it's your job to maintain that or to destroy that, right?
Right.
But when you don't have that and you have to earn it, like there's so many times where they look at me like, what the fuck? And I
Yeah.
go on and then I come out like, hey, everything went great. And all of a sudden their husband or wife or daughter or son or mom or dad is like walking, talking, like what's going, and they're like, they're so they're obviously so happy.
But they're
And
relieved
yeah,
that
and then they're like, you know what? I need to rethink how I think, which is
mm,
it goes to say for a lot of things in life, especially now.
right.
But then like, you know what? They didn't trust me at first, but you better believe, even when I was on maternity leave, some of my patients were coming to follow up and they're like, I'd rather wait. I'm waiting for Dr. Farah to come from maternity leave. She's my friend and I trust her. And like then you have that trust because you actually earned it as an individual based on your merit and not because you looked like, whatever that Dr. Dreamy
If I
from
were walk in,
if
right?
it
If
were
it
Philip,
like
they would they would
if
trust
it
it.
were me to walk in,
Mhm.
and like we jokingly we talked about like having a social experiment
Right.
with this, right? Where I just walk in a I don't know, in scrubs, and she has her Dr. Farah stuff on there, and we'll just walk in, and I just say, yeah, your Jersey artery is your artery is separated from your shoe thing, whatever. And then they were like, "Oh yes, Doctor Wolf." Right? It's and it's. I mean, I am like, I couldn't be more proud of my wife, right? I mean,
Right.
like that woman saves like she hates when I use it, but she's a hero. Like she does that because we when we go out when we're around town, we meet a lot of her patients, right? And these people are so grateful, and they're so well. They're good, they're good. They had a stroke. They got into the hospital. 2 days later, they walk out.
Mm.
And
Yeah.
that's I mean that's the best case
Yeah, the
best case
best case
scenario, right?
scenario.
And I think, and that's what I love about her so much. Like that woman is all about merit, right? And there's nothing that can. I find it hard that people are actually questioning her abilities to do so, right? And
Yeah.
it's it rubs me the wrong way sometimes, to be
Mhm.
quite honest with you, because If you have a stroke around this area in Florida, and you want my wife to
She's
be
the
on
one
call,
you want.
you want my wife to be on call, right? Because that is your best outcome
Right.
if you have that, right? And I mean the woman in the meanwhile, while she does all that, she which we talked a little about is our company Brain Theory, right?
Mm-hmm.
She develops things, and sometimes at 3 o'clock in the morning I get woken up, and she's like, "Honey, honey, honey, honey." I'm like, "Yeah, what's going on? I figured out this, how to do this, and how to do this." And I'm like, "Okay, I didn't understand the word you just said."
Right.
It's like me talking about avionics.
Right.
But it's just incredible, and I would love, and I'm pretty sure. I mean, my wife is unique, but I'm pretty sure there's other professions and things where people struggle with these kind of things,
Right.
right? Like I said, if I would walk in, nobody would question, even if I don't know jack, right? With the deep voice, like I said, like your jersey artery separated from your ankle,
Right.
and
Right.
then
Right.
people would be like, "Oh, that's horrible." Like, yeah, it did. Right, exactly. I was like, "Sorry, we would just have to put your foot and
In your
say put it to your head or something like
or in
that,
your
right?"
butt or
And
something.
I said I would really love to do this social experiment, right?
Right.
And I mean, we talked about it over the last couple of days a little bit with all the DEI hiring and all of these things that's been going on, which is I think it's just a shame, right? Like, hire the most qualified person for the job.
Yeah, I was gonna say, like, like these days you can probably blame that on DEI because
Right.
a lot of people, even in fields where that should be totally left out,
Pilot,
are pilots. They're
pilots,
pushed through
physicians.
and they're not
Mhm.
qualified just to fill
But
like the quota, the
mhm.
race or
I
the
mean,
sex quota.
we have a